I do now, right?
Yes.
Good evening. Today is March 23rd, 2021, and it is 5 o'clock. As a quorum of the board is in attendance, I would like to call to order a meeting of the Central Health Board of Managers. Do we have anyone here for public communication?
Hi, good afternoon. We have nobody signed up today for public communication.
Okay, thank you. Given that, then we will move to the regular agenda. Item number 1 on the regular agenda, receive an update from the Health Alliance for Austin Musicians, HAMM, on 2021 ACA enrollment and outreach activities, including during the special enrollment period. Jeff Canota will introduce the item, and a representative from HAMM will cover the highlights for the board briefly. Thank you.
Yeah, thank you, Chair Greenberg. This is an item that HAMM will update us on. Rachel Blair and Renee Collins will be doing the presentation in our answering questions. Myself and Kit Abney-Spells are here answering questions. So I'll turn it over to Renee and Rachel. Thank you.
Thank you. Renee and Rachel, please.
Thank you
very much.
I'm going to let Rachel take the lead on this one. She's worked really hard on this program, this presentation. Thank you.
So, wow, for those of you who follow the ACA, this has been a very busy last few weeks. Things change so rapidly in healthcare, and as you can see from the email that I sent out this morning, the federal healthcare policy changes have directly impacted our work. We have tried to work as quickly as possible to adapt and to outline the implications for the coming months and years for our shared program. Since we have 10 minutes, I would like to try to go through the slides we submitted first and then discuss why we are, in fact, rescinding our previous request and our proposal about how to move forward. This is slide 1. In summary, we used 100% of the allocated funds for premium assistance for low-income Travis County residents to fund their Sendero health plans. As you may remember, last fall, the Central Health Board of Managers voted to increase the Central Health Premium Assistance budget by $640,000 in hopes that the program would see a net increase of 333 participants. However, because of premium costs and the tax credits or premium tax credits, the additional money resulted in a net increase of 63 plans. However, that did prevent a net loss of 285 plans. As we look at slides 2 through 4, these describe our outreach efforts and outcomes during the open enrollment period last year. That included 665 personal outreach calls, texts, and emails, collaboration with 55 community organizations, 3,400 pre-recorded calls that were distributed to local musicians recorded by Austin rapper Mama Duke. 20,000 plus people were reached through our social media and traditional media campaigns. And we had multiple videos produced by and for musicians of color, educating them on the benefits of joining HAMM, premium assistance, and the ACA. We're very encouraged by the positive results of our new program participants that we feel are the best demonstration of our outreach efforts. So these are people who have joined the Premium Assistance Program for the first time. The enrollment of musicians of color in this subset of our population grew 20% over last year, making up 52% of the enrollees in the Central Health Premium Assistance Program. New enrollees are musicians of color. Our expanded report that was distributed previously includes demographic data over the years for HAMM as compared to Travis County demographics, as well as the Austin Music Census. We are continuing and ramping up these outreach efforts for both this special enrollment period that we're in right now, it ends on May 15th, as well as the next open enrollment cycle this fall, which begins technically on November 1st, although the work for it certainly begins well before that. You may have had a chance to read our most recent communication to you that I sent today, and to summarize, in case you haven't, we previously asked the board in the last board meeting that you consider funding an additional 275 new program participants during the special enrollment period that would have cost approximately $390,000. However, with the American Rescue Plan Act of 2021, we are rescinding that request as we believe that the new legislation allows for greater APTCs or tax credits, thereby potentially freeing up money in the budget to use for new enrollees should the Central Health Board of Managers be open to that. For this fiscal year, we're anticipating that between $330,000 and $500,000 could be freed up. And then next open enrollment cycle, where enrollment begins in November, but premium prices would change in January, that could free up potentially a $1.3 million. Also included in our email today, we have updated our request to revisit our funding needs for outreach and for our outreach and navigation program, and would appreciate your consideration for directly funding HAM in the amount of $150 to support this work for the current special enrollment period and the open enrollment period coming up this fall. If we were to wait until the next Central Health budget cycle, we would limit the impact of our outreach work and on the immediate open enrollment season, as we would be just weeks away from the start of open enrollment. Having a funding commitment from Central Health during this FY would allow us to build and scale this effort with a long enough ramp time to have maximum impact possible before open enrollment starts. And really, we just want to say emphatically that we are so grateful for this long-standing commitment and collaboration with both Central Health and Sendero Health Plans, and the support that makes this insurance coverage affordable and accessible for Austin musicians. This program, in partnership with Sendero, is exceptionally high value, effective, and an essential resource for Austin's musicians. Thank you.
Thank you, Rachel, for that very informative and important update. Members, any questions? Manager Valadez? You're on mute.
I just want to make sure that you meant $150,000, not $150.
Yeah.
Did I say that?
Yeah.
I knew I was going to do that. Boy, that's a cheap.
We'll give you $150.
That's a cheap outreach program.
No, I should have said something. I made that same transition. I knew it wasn't 150.
I appreciate that. Thanks for the catch. Yes.
Okay, I'll get that. That's efficient.
Yes, yes.
I have a question, Madam Chair.
Absolutely.
I'd like to know whether or not this item can be acted upon during this meeting, or do we have to wait till the end of the month?
No, this is not posted for action. This is simply informational. So if there were to be any action related at all to this item, it would have to be posted on the agenda for our next regular board meeting.
I know when I helped develop the request for this item, I did want it posted for action because May 15th is the end of the special enrollment period. And so I would like our board members to please take that into consideration as you know, we are already in the second month of the special enrollment period for signing people up. And now that we know that the Rescue Act is going to allow for additional dollars to be accessed by possible insurees, but they're going to need the support of people to help them access those dollars throughout that process. I'd like to make sure that if we could please post it for the board meeting at the end of this month, you know, May 15th is going to come really fast. And when you're navigating and you're enrolling and you're reaching out and you're educating people, time is money and time flies by very quickly. So please take that into consideration.
Of course. Thank you. Our next regularly scheduled board meeting is in fact a week from tomorrow. It's next week.
Next Wednesday.
Wednesday. Yes, a week from tomorrow. Members, any other questions right now? I'm scanning. If I miss you, just please get my attention. Speak up. Manager Musaitov.
Thank you, Chair. Thank you, Rachel, for coming. I appreciate all the work that you have done with HAM. It's phenomenal work, and I definitely support this item, and hopefully we can move forward. And I just want to commend you on your outreach and the work that you have done. Thank you.
Thank you, Manager. Anyone else at this time before I move on to the next agenda item?
Yeah, Chair Greenberg, this is Jeff Knoble.
Yes, Jeff, please.
So there's nothing that prevents HAM from re-enrolling current enrollees right now in order to free up capacity for additional enrollees. Is that correct, Rachel? I mean, your ask is really for outreach in the upcoming year.
Right.
And so it's independent of actually enrolling additional HAM members in the current I'm sorry, I can't remember the name of the act now. I'm drawing a blank.
ACA. That's what I heard.
Well,
right?
the Biden.
The new
Rescue Act.
The Rescue
Act.
Act.
Yeah, thank you.
Jeff, I wanted to make one point clear. It's actually both and is what I like to call it, because this is going to take an extraordinary amount of work to move the 1,500 people through to do this. But also in terms of our outreach, while we have seen really significant results, we know that in preparation for 2022, if we wait until your fiscal year and when it's time for you to be starting to plan for 2022, we won't get the funds in time to do the kind of outreach that we still want to do. We're absolutely committed to doing better and having more outreach, but it does take time. And then Rachel, you jump in.
But Randy, let me make sure that everyone understood. And Jeff, I'm glad you asked that question. What I understood was that you're rescinding the request you had for the 300,000 or so. Because of the funding that you now have available with the Rescue Act, and you're freeing that up, and that, yes, what you're asking for is 150,000 for outreach for 2022. Is that correct?
That's correct.
Okay. And Jeff, thank you for making sure that's clear to everyone. Did anyone have anything else to add at this time? Manager Valdez.
Just clarification, Rini and Rachel, I thought it was to begin early in laying that foundation for the November 1st enrollment period, but also to build the infrastructure that's going to be needed in order to be extra successful for November. You're already going to be working on it. You're working on it now, but you really want to see if we can hammer down and get those additional people enrolled before May 15th. Is that correct? It takes
Absolutely.
a lot of work. I used to do that. So
absolutely. So the idea would be that we would help facilitate the process to free up this money by doing the communications and the person-by-person work to have those plans be updated, thereby freeing up the money that would then create room for another enrollment. And then we would do the outreach work, try to bring somebody in and get them enrolled in a plan. So it's sort of like two open enrollments running at the same time. And
I want to make sure that everybody understands that you're not going to be sitting in an office at a desk waiting for somebody to come to you. You are going to be up and at them. You're going to be out there reaching out, working with groups, expanding the outreach efforts, educating the people, and you are also going to be working with groups that you historically not accessed that are musicians in other populations. You know,
that's exactly right.
Thank you very much. So one of the jobs I have whether I like it or not, is to keep the trains on time. So I appreciate it. Thank you, everyone. Is there anything else before we have to move to the next agenda item?
This is Jeff
Yes.
again. Just real quickly, and hopefully this isn't fake news, but it looks like they've extended the special enrollment period by an additional 3 months to August 15th. So thank you.
Oh, all right.
Wow.
Hot off the presses, I guess. Yes,
More
Jeff?
need for action.
Yes. Okay, good. We like having that time. Thank you so much. All right, we will move on to agenda item number 2 now. Receive and discuss an update regarding Sendero Health Plans, Inc., including 2021 ACA enrollment and financial updates. Wes Durkowski will be presenting.
Thank you, Sherry. Board of Managers, I'd like to thank you, and we appreciate having the chance to spend a little time with you. So for today, there's no ask, but we should have some good stuff for some information, get you up to date, and answer any questions. So to start, in open session, we'll just do 2 or 3 slides. And for those, I'll introduce my CFO, Ellie Barreneche.
Please proceed.
Did she lose her scent? Oh wait, is she stuck on mute? Then maybe I'll keep going until she can.
Let me look for her.
She can click on.
I think I'm unmuted.
You
Can you
are.
hear me?
Proceed, please.
Okay.
Thank
Go
you.
ahead.
Sorry, I had
We'll
to
go
click
quick.
2 different buttons. Sorry about that. Good afternoon, everybody, and thank you so much for having us today. Yeah, we wanted to go through our short agenda, hopefully. The first item that we will touch on is the fiscal year 2020 results. Then we will move on to the 2020 membership and projections. Then we will talk about NovaRest independent actuarial review and projections. And then we'll talk about our summary of the Sendero projections and then the business model and strategy before we transition to closed session. And again, like was said, all this is for informational purposes. There is no action needed. So to begin with the fiscal year 2020, yes, Sendero ended with a capital of 15.2 million and 360% RBC or risk-based capital. That is the capital that is required by the Texas Department of Insurance. And usually we want to be above 300%. Our statutory income or loss as reported was 6.6 million. If you recall, during our last meeting, we talked about 3 different strategies that Sendero implemented to cut on those losses and to improve the business for 2021. And those items that we touched on were in specialty providers, pharmacy, and also now narrow network. Going on to the 2021 membership, Sendero is expecting to end with a projected average of 7,650 members for 2021. Of those, we have 657 CHAP expansion members and 1,233 premium assisted members, and those are HAM, SAMS, and MAP. For the special enrollment period approved by the new administration and the new APTC guidelines or advanced premium tax credit guidelines, we believe that Sendero will be favorably impacted by those 2, and we can add a few more members to our plan. The membership is projected to stay level or increase in 2022 and forward. Our next item to discuss is the NovaRest independent actuarial review. So if you recall, Central Health in the past has engaged with NovaRest Actuarial, and they usually have done an analysis on Sendero's projections and have reported back to the board. This year, Sendero reached out to NovaRest to complete an analysis The report was issued to Sendero, so we can share with you during closed session, but we still wanted to include a couple of quotes with you in open session. These quotes here basically say that I'm just gonna read them. We were also asked to project financial impact through 2022. We ran a couple of scenarios based on Sendero projected membership resulting from different rate increase assumptions. We found that under varying assumptions, statutory income was negative for 2021, but risk-based capital is projected to be above concern levels, so above that 300% mentioned before. They also noted that the ratio of chat members is large enough that they project a risk adjustment receivable which is not paid until the following year, which may cause cash flow issues. As you all are aware, Sendero is transitioning to care for a greater number of high-risk members, and these member premiums do not cover the cost of care until the risk adjustment funds are received in the following year. Usually, they're received in the fall of the following year. Sendero has identified the amounts needed to prevent cash flow issues and some options to remedy those issues. Next slide, please. Thank you. Our financial projections, so our administrative costs, since 2017, the year that we had our greatest membership, our risk-adjusted premiums have actually declined by 40%, and the administrative costs have declined a corresponding 38%, stabilizing despite the increased member acuity. Our 3-year projections from 2021 through 2023. So a projection at current membership levels indicates that we're going to have some losses that are manageable. Without any mitigation, our RBC in 2023 may end below the desired levels, but the remaining capital will be sufficient to wind down if that was necessary for 2024. Because of the CHAP expansion programs and the related risk adjustment receivable is not collected until late in the following year, cash borrowings will be required at the end of 2021 or early 2022. And then last, on the business model discussion, we are going to be moving into closed session, but there is one thing that I wanted to share with the board that we're very proud of, and it was a conversation that we had with the public about COVID vaccination, and we have our board member, Cynthia Valadez, among many others, in that discussion. So we're very proud to have done that. And also very proud to have been able to be added to some publications in very reputable publications. One was the Sendero Health Insurance Network provided data in public data sets to identify SARS and COVID-2 vaccinations in the USA. And that one was to build the resources to distribute vaccines based on our data, since there was no other data available. So that was published on Frontiers in Public Health in January 2021. And then the second one is the Acute to Action pilot project to increase screening mammography. That one was published in the American Journal of Managed Care in February of 2021. And that one was a study where we tested if outreach, education, and incentives will increase uptake of screening and mammography among women. And with year-over-year intervention, we more than doubled participation through this outreach. So very happy to have contributed to these publications. And that concludes this part of the presentation, unless there are any questions or comments or anything that Wes would like to add.
So I'm going to, if members Is there anything before I announce that we will move into closed session? Manager Valadez? You're on mute.
If I could ask Dr. Bell if his board is in support of this presentation and this going forward plan that we have heard today.
Our board has the information that you're receiving. I'm not necessarily sure there's any action to be taken at this point in time. You will get more detailed information, and we will talk a little bit more with regard to the cash flow issues, et cetera, as we go into open session.
Into closed session.
Closed session, sorry.
Thank you. So at this point, I'm going to announce that the board is convening in closed session to discuss agenda item 2 under Texas Government Code section 551.085, governing body of certain providers of healthcare services, and item 3, which is discuss and take appropriate action on Central Health owned or occupied real property and potential property for acquisition, lease, or development in Travis County, including next steps in the redevelopment of the Central Health downtown campus, administrative offices, Central Health Enterprise Partners, and new developments in eastern Travis County. And in item 3, we will be going to closed session under Texas Government Code section 551.072, deliberation regarding real property, and Texas Government Code section 551.071, consultation with attorney. So now, members, we need to leave this, and everyone should have the site to go to for closed session. I will see you shortly. Thank you. I'm looking for a quorum.
You have a quorum if you want to go ahead and start.
I do. So we are out of closed session. There is no action necessary on agenda items 2 and 3. Members, do I have a motion?
To move to adjourn.
Is there okay, there's a motion by Manager Valadez and a second by Manager Bell. All in favor? Aye.
Aye.
Opposed, same sign. Any abstaining? Thank you, members. That motion passes. Let's take a 5-minute break, and then we will get on the link for our board retreat. Okay, see you then. Thank you, members.
Chair, are we going to
Yes.
be on a different link?
Yes, you will get on the link that you were sent for the board retreat. Yes, so
We leave this meeting.
leave
Okay.
this meeting, take a 5-minute break, and then go on the link for the board retreat. Thank you for the clarification.
Thank
Ms. Saito.
Bye.
Bye.